Hello, everyone. Thanks for joining us for today's webinar on the latest with the COVID-19 telehealth regulations. We will have a brief presentation followed by Q&A. To ask a question, you type it into the questions box that you see on your screen. In the box at the bottom of the screen, you can download a PDF copy of today's slides. We are recording this webinar, and we will post the recording on our COVID-19 resource page, which you can access by going to our website, diabeteseducator.org. We'll also have a direct link for you to that page at the end of the webinar. With us today are Diana Isaacs, Endocrinology Clinical Pharmacy Specialist and CGM Program Coordinator at the Cleveland Clinic, Patty Telgener, Vice President of Reimbursement with Emerson Consultants and ADCES's reimbursement expert. And from ADCES, we have Kate Thomas, Director of Advocacy, Sasha Yeoman, Director of Diabetes Education and Prevention Programs, Leslie Kolb, Chief Science and Practice Officer, and Joanne Rinker, Director of Practice and Content Development. So for now, I will throw it over to Joanne.
Thanks, Megan. So first we're going to kick off today with Diana Isaacs. And the reason we asked Diana to join us today is because Diana really has been doing telehealth successfully, and I wanted her to just share a story with the group before we jump into some of the updates and additional Q&A. While she's talking, if there are any questions that you have specifically for Diana, in the questions box, just write Diana and then the question that you have. And then if it's a general question about telehealth and telehealth waiver, et cetera, we'll do those at the end. But let me turn it over to Diana.
Well, thanks so much. It's great to be here with you all this afternoon. So I want to share a quick story about a telehealth experience. I've actually been doing telehealth even before this pandemic, but certainly now doing a whole lot more of it. So we recently, we had a patient come in who, he's a 24-year-old male and newly diagnosed with type 1 diabetes. Like he had actually just recently had a hospitalization for DKA and came to us really fresh out, like a week after being diagnosed. This was about early in March, so kind of right before all the restrictions, started happening and everything. So that day in the clinic, he met with me, a pharmacist and a diabetes care and education specialist, and our endocrinologist. And immediately that day, we were able to start him. We started him on mealtime insulin. Believe it or not, he was only on a long-acting insulin when he came to see us. And we were able to give him a sample of a Freestyle Libre. So he actually lives about 3 hours away. So it made sense even before, the restrictions on in-person visits to schedule a telehealth visit. So I scheduled with him about 1 week after that initial visit, and we use a platform called American Well, which was already set up with our clinic. And the nice thing about this platform is it's integrated with our electronic medical record of Epic. So when the person checks in, it checks in on Epic, and I can put my note directly in that electronic medical record. So that's what we did, and it has a video, and a chat functionality. So we were able to connect that way, review the glucose readings, and we really had started him on just kind of a set dose of prandial insulin. So we were able to go through what his numbers were and try to fine-tune it. He also, as you can imagine, being a newly diagnosed person, had a lot of questions that I was able to answer for him and go through his glucose targets and all of those kind of things. He immediately was interested in getting a CGM device that has alerts that can alert him for high and low glucose levels because he lives alone. He also, he'd been reading a lot, and he was eager to already get started with his carbohydrate ratio and all these things. So he's a pretty motivated person. So I linked him up with an app that I use called Map for Health. And what I like about this app is it allows a person to take pictures of their food, and then they can, type a little tag to it, like about what they ate. And then I'm able to log in and see all the pictures of the food. And so what we did then, we scheduled a follow-up visit about 2 weeks after this visit, where we were able to connect, review CGM data, and review the food, the pictures, and everything. Also during this time, he ended up switching and getting Dexcom. So I wasn't there in person. By this time, there's all the restrictions, and plus he's 3 hours away. So he was actually, Dexcom is approved for self-starting, and he's a pretty smart guy. He was able to watch the video, but then through the video functionality, I was able to walk him through kind of the other steps. And the nice thing about this being on the CGM data is on Bluetooth, so we immediately got him connected with our account here, and so I was able to view that data, explain what it means, and go through all of that with him. So one thing I want to add, because it's not always smooth, right? So many people were doing telehealth visits at my health system that the American Well platform started to freeze a little bit. So we came up with a workaround that's worked very well. Is we're actually just using FaceTime. So we're using FaceTime for people that have iPhone, and then we're using Google Duo for people that have Android phones. This allows us to still have that video component, and they've actually been able to link it up in our Epic where they schedule the visits so that we can still document our note under that patient. There's still a scheduled time so the patient knows when that visit is occurring. So that's been working out really well. I know there's going to be questions about billing and stuff because I'm a pharmacist, and so I am not, according to the laws right now, able to bill with telehealth. Now, that being said, there are, with some of the CGM interpretation, I've been able to route that, like with the 95251, I've been able to route that to our provider to co-sign and try to get some reimbursement for that. Also, this patient has an endocrinologist follow-up, I believe like next week already, and that will be a billable visit. But at least I've been able to support this person, in his new journey with type 1 diabetes. So I think if he could talk, he would tell you he's been very happy with the process, and I'm happy with how it's gone, and I'm happy to answer any questions about it.
That's awesome. Thank you so much, Diana. So it looks like the question we have for you is, what was the platform for Android? So they might have just missed that.
Yeah, so it was Google Duo, and so it's basically like a FaceTime that just works for Android. So what we've been doing is asking our patients if they have basically an Android phone or an iPhone. Actually, the Google Duo will work with an iPhone too, but a person does have to download that app to be able to use it.
Okay. And then, Diana, will CMS move to cover CGM training CPT 95249 via telehealth? Is anyone working on requesting this change?
So I hope so is the answer, because to me it's like you can really do all the parts over video and you can review the data and have that data download. But I am not, I don't know the full answer to that without contacting CMS. I hope someone's working on it.
And the other question we have that was specific for you, what app did you mention that people can take pictures of their food to share?
Yeah, so it's called Map for Health. And basically, yeah, that's the app where people can take pictures, and then you can get, if you have like a clinic subscription, you can link up to their account where you can actually be able to see all those pictures and everything and any tags. And actually, if you have an iPhone, you can link it up with your other data, your Apple Health data. So it's pretty interesting.
Yeah, that's pretty awesome. All right, Diana, well, thank you so much for joining us. Please feel free to stay with us today in case someone has a different question for you. And let's just go to some of the next slides, and we just have a few today, and then we're going to take some more time for some other general questions. So next thing I just want to share is that we do have lots of telehealth resources currently available on our website. So the link is here, and just, so you are aware, these slides and the recording will be available on our website. And don't forget that that is also where you can find, as we get further in the slide deck, you can also find our frequently asked questions from these sessions. Now I'm just going to turn it over to Kate to do a quick update about FQHCs and rural health centers.
Thanks, Joanne. Hello, everyone. And I'm going to cover some material that we did cover last week. There hasn't been any new information released on federally qualified health centers or rural health centers since last week, but you know that we got that big update with the release of some additional guidance from CMS early last week, so just wanted to reiterate some of that. As you know, the CARES Act passed at the end of March gave CMS some additional authority to expand telehealth services in FQHCs and RHCs, and we have long awaited for that guidance to come out so we could best advise people on how to implement that and to practice and to take on some of the billing tasks associated with that. And so on April 17th, CMS issued this specific guidance, which is linked in the slide. That really covers everything from who can provide the service to what codes you need to use, when, and so there's a lot of great information there. A few things that I want to highlight is that services can be provided by any healthcare practitioner working for the RHC or FQHC within their scope of practice. I think this was an important win in the DSMT world because we've been facing so many struggles with RNs and pharmacists being able to provide DSMT through traditional settings in Medicare Part B. That doesn't change that, but we're happy to see some of these advancements being made in this recent guidance. Practitioners can furnish services from any location, including the practitioner's home, and they can provide services to the patient in any location, including the patient's home. We know that the same rules apply under normal circumstances, that accredited, recognized DSMT programs in FQHCs can be reimbursed for one-on-one DSMT using the GO108 code. This service is now able to be provided via telehealth during this public health emergency. And then we're talking about telehealth, just an important reminder that CMS defines telehealth as real-time audio-video communication. We've been advocating for some of these audio-only channels, but unfortunately CMS has not authorized that yet for traditional telehealth services. So that's something to keep in mind as you're pursuing this within your facility. And then a few additional pieces of guidance. For services furnished between January 27th and June 30th of this year, RHCs and FQHCs are asked to use the modifier 95 to indicate that this is a telehealth service. And then there's some additional guidance for services furnished after July 1st, 2020. I think CMS is going to evaluate how long this public health emergency is going to last and what needs to happen after that. Again, these changes only apply to FQHCs and RHCs. And in addition to the Medicare Learning Network article that's referenced in the previous slide, which really has all the information from CMS, I did find a really interesting resource in the Center for Connected Health Policy, which is a YouTube video that provides some additional guidance. This Center for Connected Health has some really great resources that we've been recommending throughout these Q&As. So I would encourage people to check out that site as well if you're looking for some additional information.
That's great. Thank you so much, Kate. Additionally, we have some links here for Telehealth Resources, Medicare guidance on telehealth, Center for Connected Health Policy reference sheet, HIPAA, and then the Academy of Nutrition and Dietetics resources. And then we also have Medicaid information here for you. So Center for Connected Health Policy Interactive State Map, Medicaid, State Medicaid Waiver List, and State Medicaid and CHIP Telehealth Toolkit. So just wanted you to be aware that in the slide deck there are some additional links that might be helpful for you. And then Kate, I'm going to turn it over to you one more time about our call to action before we get to our Q&A.
Sure. So this is something that I'm very excited to report that we have had over 632 letters sent via our Legislative Action Center to CMS, their waiver team, the 1135 waiver team, asking them to include nurses and pharmacists in the list of eligible providers who can provide DSMT. We keep having daily conversations with CMS on this issue. We're still awaiting additional guidance. I think CMS has been very vocal that they have an additional round of rulemaking to go to address some of these issues. So we're hopeful that that is included. But every letter that's sent really is a way to show our visibility before CMS to really get their attention. So I would encourage you to continue to share the link, to share this with your friends, family, colleagues, clients, anyone who's willing to take action. And then I also wanted to mention that we've had quite a good response from our congressional supporters as well. Senators Shaheen and Collins, who are co-chairs of the Congressional Diabetes Caucus on the Senate side, have taken an interest in this issue, and so they're circulating a sign-on letter for their colleagues in Congress to put some additional pressure on CMS to make this change. So just wanted to let everybody know that we're really trying to work this advocacy issue as well as many of the others that are facing our members and diabetes care and education specialists at this time. So we're leveraging every advocacy channel that we have to do that.
That's great. Thank you so much, Kate. So we did have a few more questions for Diana. So Diana, one question was, how do you use handouts on FaceTime?
Yeah, that's a great question. So I try whenever possible to just email them. We do in ours, we have a chat feature too, and we are able to attach documents, so that's another option too, but many times I'll email things in advance as well. So that's one way, and then also just with the video, it allows me to directly put the video, like my webcam on something. So like the other day I was trying to explain what different CGM data meant and about time and range and everything, and I was able to bring it up close to a CGM report and show that person. So I feel like all the same tools you can still use, but definitely helps if you can, email it or attach it before or during the visit.
Sounds good. And then are you using MyChart as your link in Epic to do telehealth with your patients? My facility has Epic, and we are just starting to look at using the MyChart as an avenue for telehealth.
So we use MyChart to communicate, so that's more like messages. They're not real-time messages. So we use that definitely to communicate in between visits, but in terms of the actual platform, we're using American Well, which is then linked up through there, but it's separate.
Okay. Just a couple more for you. Can you slowly state the food photo app again?
Yeah, it's MAP, like M-A-P, 4, the number 4, and then health, just health.
Perfect. Thank you. And then by what means are programs sending a HIPAA-compliant questionnaire to their patients?
So we actually, we have questionnaires that go through, so someone was asking about MyChart before, they actually go through MyChart, so, and then that's considered HIPAA compliant. So I'm not sure what other places are doing, but we've mailed things too, but we try to go through MyChart whenever possible, and we do it that way.
Okay, cool. All right, so I think that's all that we have for you for now, although I'm sure that we will have more as we're talking. So
Yeah, keep them coming.
Yeah, it's really cool. Sasha, one question for you. If we, and this is an RN or pharmacist, are able to do face-to-face individually, citing no group class in our area in the next 2 months, do we need a written order? And what additional documentation should we have for any future audits to be able to offer this service to our patients?
Oh, okay, yeah, great question. Yes, you can definitely, as far as we're concerned, you don't need to request another referral because there are no additional classes available within 2 months, and that's a reasonable reason for one-on-one. And so just make sure in your chart note that you document that it was a telehealth visit. I would encourage you to do that in your chart note, and then possibly in your note to your referring provider. Let them know that the visit was done via telehealth, so you're being transparent about, telehealth, that was one-on-one in person. You could state that in your note back to the referring provider just to let them know, but I don't know that that would be a concern. Just make sure it's in your note.
Sounds good. Thank you. I see a lot of really great questions, and as we go through these, I just want to let you know that the good news is a lot of these are actually in our frequently asked questions document that we have on our site. So be sure to go to that to the link to our website and check those out. All right, a couple of other questions that are coming in. I'm going to turn this one to Leslie. In reference to nurses not being able to bill for telehealth, If a nurse does diabetes education via telehealth and we are billing as an outpatient facility, not an individual provider, is that okay?
So I am not sure how many different ways we can particularly answer that question. According to the Medicare regulation, neither an RN or a pharmacist qualifies to provide the telehealth services. If you want to do this any other way, I would have to encourage you to talk to your billers and your directors and maybe even your legal. All we can do is give you the guidance that we are given based on the regulations. And I wish I had a better answer than that.
Thank you, Leslie. And kind of in that same bucket of questions, we have one more for you, which is, if an educator is an RN and a CDE, does that make a difference to CMS?
Great question. We get this one a lot. So if you hold a CDE or a CDCES, which is the same credential with the name change, or the BCADM, you show the expertise and the level of knowledge that you hold as a diabetes care and education specialist. But neither one of those credentials changes anything with any billing as far as Medicare is concerned. I can't speak to all private payers, but the bottom line is no, it does not matter if you hold one of those credentials.
Thanks, Leslie. And then this one is for Patty. Is there a place of service code if we are doing telehealth from our house?
So this is a great question that's also included on the frequently asked questions, but let me kind of summarize here that CMS is now saying that providers can report the POS, which is point of service, that would have been reported had those services been in person. So for example, if you are a physician's office, that point of service would be a site of service 11. So you would use that plus the 95 modifier, which designates that as telehealth. So at least today, the point of service code 02, which would say patient's home, is not to be used. So again, point of service would be as if it was done in person, and then CMS is requesting the modifier 95 be added, so to clarify that it was done via telehealth.
Great, thank you, Patty. And then another one for you. Does a telehealth code have to be used when billing, or can we just document in the DSMES program notes that the visit was telehealth?
If I understand the question, I think it ties back to the one that we just talked about, that if it's provided via telehealth, CMS today is requiring that that modifier 95 be added. So it would be the same G code, but you would have a modifier that would indicate on the claim that it was done via telehealth. And then, as always, I would encourage the documentation to include that it was done via telehealth as well.
Perfect, thank you. Patty, can you let us know, have there been any changes to the use of UB04?
So there has not been any change on CMS allowing telehealth to be reimbursed for claims billed on a UB04. We continue to be optimistic. If anyone is attending kind of the office hours with CMS, this question comes up a lot, not just in the diabetes space, but across PT and OT. But there has not yet been any change.
Great, thank you. Any other updates or anything else that the group would want to share before we wrap up? I'm just going to look and see if we have any other questions. One last one for Kate. Are you aware of waivers regarding providing DSMT virtually across the state lines? For example, I have several snowbirds in Arizona and California, but I'm in Washington.
Well, I think my perspective would be CMS has been asking states to waive certain licensure restrictions. So so that you wouldn't be confined to practicing just within your state. I think there's really a push to have some of that interstate practicing. I think it would just depend on what the licensure requirements were in your state and the state where you were providing the service. So I would just check with your licensure board in that particular state to see if they've waived some of the restrictions, but it's something that the administration, that CMS, and that a lot of the local governments have advocated for. So I think that there should be some opportunities there, but just check with the respective licensing boards to make sure that you're okay to do that.
Great. Thank you, Kate. So before we wrap up, I just want to make sure everyone is aware this was kind of our last of the weekly webinars. Our plan moving forward is that we are going to kind of keep up with, as we have been, CMS. And if there are new updates and new information to share this way, we will potentially have some live webinars in May, maybe every other week or something like that, so that there is this opportunity to ask questions as well. Also, please keep in mind that we have that frequently asked questions document on our website, and we will continue to update that document. And just be paying attention to your email, so that if we do have another live Q&A, you can get registered and join us then. I'm going to turn it over to Megan to wrap us up, but I do really appreciate everyone being on today and your participation and questions.
Great. Thank you all so much. And yes, again, we want to thank you all for attending and asking your questions. And we did record this webinar, so we will post it on the COVID-19 resource page, which also has all the recordings from the past webinars that we've done, so make sure you check that out. I have a link to that page on the screen here in the web links box at the top. And I also have a link to the mega thread discussion going on the new ADCES Connect. So make sure you check that out as well. And you can download a copy of today's slides in the box underneath the links. So we'll leave the room open for a bit to give you a chance to check out the links and download those slides. And we want to thank you all. This concludes today's presentation.